Core Physio and Pilates video series. I'm Lee and this is Liz. This next series of exercises is for our beautiful pregnant clients. Pregnancy puts a huge physical demand on your bodies. Increased hormones, increasing bellies, and all the laxity in your ligaments means that you really need to stay strong and stable through your pregnancy. These exercises will help you stay strong and also will help your recovery after you've had your baby. The first exercise is done on all fours, on 4-point kneeling, called a pelvic tilt. So Liz, if you can come onto your hands and knees, making sure that your shoulders are directly underneath your wrists and your pelvis is nice and stable. As you breathe out, you're just going to do a little bit of a tucking in your lower back and lower belly, forming a nice little curve through your spine. And then as you inhale, just a small little tip the other way. We're going to do this 10 times. So as you exhale, you're tucking in your tail to really round your spine, and then going back to neutral and pause, making sure that your neck is nice and relaxed. We're going to do that 10 times. Tucking in, this is called a pelvic tilt. She's doing a great job there. And pause. The next exercise is in the same position, and this is known as cat stretch. So it's going to be a much bigger movement. Liz, as you breathe out, we're going to start by tucking in your tail and then start to look down and round your upper back, forming a nice big C shape or a cat yawning. That's really nice to open up your upper back and lower back. And as you inhale, we're going to start by lifting the gaze up, drop your upper back. Lovely. Let your whole spine go into a nice extension. Really nice to let that belly open and open the ligaments of the spine. And as you exhale, doing that again, tucking in your tail, drawing in through the front of the pelvic floor and lower tummy, tucking in. And as you inhale, let your upper back start to bend first and extending your spine. This one feels lovely. Keep going, Liz. You're going to do this one about 10 times or even more. It's really nice if you've got any lower back pain or pelvic instability. Good. And just rest there. The next exercise is also done in this position. If your wrists are getting sore, feel free to change the order of the exercises. This is known as quadruped with an opposite arm and leg float. I need to warn you that if you have any pelvic girdle pain or any pelvic instability, avoid lifting the legs. Keep the legs nice and still. So as you breathe out, Liz, you're going to slowly extend your right arm and your left leg behind you, keeping your pelvis really still, and then bringing it back. Good. You feel okay there? Yep. And again, so drawing in through your pelvic floor and tummy, opposite arm and leg, and bring it back. I'm going to get you to do the other side now, Liz. And as I mentioned before, you can just do the arms or just do the legs, but any pelvic instability, avoid the leg component. I'll just get you to demonstrate just one repetition with just the arms, please, Liz. Exhaling, reach, drawing in through the front of the stomach. Good. Letting your muscles really hug and support your baby. Good. Take your knees nice and wide, Liz, and we're just going to sit back for a lovely stretch. This is called child's pose. It's really quite nice to open up that pelvis and allow some space. Good. You can take maybe 5 to 10 lovely breaths here. So she's going to take some nice breaths, opening the hips as much as she feels comfortable. The next exercise is known as side lying glutes. So if you could please lie on your side, please, Liz. You can have a pillow for your head or just use your arm. Your bottom leg is bent. You're going to straighten your top leg, making sure that you've got a nice long waist, drawing in through the pelvic floor. And as you breathe out, it's just a small lift of that top leg up and down. So just keep working through this, Liz, and we're really keeping sure that your pelvis is staying nice and still here, girls. If this puts any strain through your pelvis, I'd avoid this exercise. This should be felt into your glutes. Good. So just pause there for me, bring the leg down, bend your knee. You can do up to 20 repetitions of this exercise, or you can start obviously at a lower dosage.